Living in Virginia, you're in the fast lane on the information superhighway. We've invested $3 billion in Virginia's broadband network to give you one of the fastest internet connection speeds in the world, so you can build relationships, bring new business to our state, and meet the future of education. It's amazing what we can do together. Visit VCTA.com to learn how broadband connects the Commonwealth.
From the General Assembly and the City of Richmond, I'm Woody Evans for Cable Reports, brought to you by the VCTA Broadband Association and Comcast, connecting Virginians to their government. We're pleased to have a freshman member, Carrie Coyner. It's good to see you.
Hi, nice to see you.
Tell us so far how it's been. It's been almost 2 weeks. This is a new environment for you, although I know you were a school board member, but tell us about your experience to date.
Yes, so it's very different than local government. I have figured that out in 2 weeks. The pace is different, and also just getting a handle on committee assignments and how to maneuver and bills going from subcommittees and committees. So I'm learning a lot, leaving here exhausted every day, so that's a good thing. It means you're working hard, so learning a lot.
Tell us a little bit about the district you represent.
So I represent the 62nd District, which encompasses the entire city of Hopewell, a very small portion of Prince George, if you live along River Road, that small little area of Prince George, and then southern Chesterfield. So anyone who lives in the Enon community, up through Chester, and a little bit of the Salem Middle School, Salem Elementary School zone.
So what supports the economy? Who are the major employers in your district?
We are the backbone of Chesterfield County. We are home to all of the industry. So Chesterfield County, all the different industrial parks, the Walthall Industrial Park, the Meadowville Technology Park, we're home to Amazon, we're home to all of the large warehouse companies that are moving in, Sabra. Anything you eat or that's packaged is typically in the Bermuda District in Chesterfield there. And then the city of Hopewell is also a very strong industrial center for our state as well. So we have a lot of major employers who have lots of great jobs, always looking for more young people through workforce training to want to come into those jobs that we know we have a lot of folks retiring out of. So engineers and folks who are able to fix equipment, a lot of technical jobs.
So that Amazon site predates the recent move of Amazon to Northern Virginia, I take it.
It does. So the Amazon site in my district, I can actually walk to it from my home. It's on my running route, but it is one of the first warehouses that was brought to Virginia. So it's been there probably 8 years, maybe 9 years. And it was one of the first distribution centers. It is one of the distribution centers that handles smaller things. So if you were to tour it, it doesn't have the big screen TVs and furniture and large items. It's the place where the Barbie doll or the package of gum and the smaller items that you typically order, it's where things come in from there and get shipped out.
So tell us a little bit about your experience as a member of the local school board and how that will help you here.
Sure. So I served for 8 years on the Chesterfield County School Board representing the Bermuda District, which almost the entire area of Chesterfield I'm now representing in the state office encompasses, and served there really advocating for equity in education, looking at how we're allowing teachers to teach and focusing on less testing in our schools, and really hoping to shift the conversation from where we are today. Our testing system focuses on grade level achievement, but not every child shows up to school starting at the same point of the grade level. So I worked really hard trying to help us move towards a conversation about growth, where we see every child, wherever they begin at the beginning of a school year, parents, that child, and the teacher can expect and should be able to see at least a full year's worth of growth from every student. So those are some of the things from the school board I was passionate about. And I think the skills I learned at the school board level, working with other colleagues where you may not always agree on every issue, but how do you get to compromise and what's best for the people you're representing is a skill I was able to bring with me to the state.
So I imagine you heard a lot from constituents and students about these standards of learning?
Yes, lots. I'm a parent also. I have 3 children. I have an almost 13-year-old, an 11-year-old, and a 10-year-old. And we have lots of conversations about what's in the best interest of all kids. So as a parent and also as a school board member, I know full well what our standards of learning are not doing and where I believe we could be as a state if we moved in the direction of what some other states are doing as well.
Well, talk to us about that direction we should move to.
Yes, so it would be wonderful if as a state, if we moved away from our current testing model. So the state of Virginia, through our standards of learning, we are an achievement-based state. And there are some states that you would classify as value-added measure states where they have different things that they measure for success of students. We have some states that are growth models, and there's different kinds of growth models. You can have a individual growth model where you're just measuring that one student and where they were and where you want them to go. You can have a growth measure that models that student after other typical peers, and are they growing as much as typical peers in their subgroup should. And then you can have a state standard based on growth where that student should be based on categories that they fit in within the state. I'm really hoping our state moves away from achievement. What I saw in Chesterfield County, which we're a very diverse community, one of the largest school divisions in the state, we are labeling children and we are labeling teachers and we are labeling schools as failing or not being successful, even though some of those same students and teachers showed more than a year's worth of growth, but the child started perhaps 3rd grade at a 1st grade reading level.
And unfortunately, those labels tend to stick, do they not?
They do, and if you've ever had a label, even though you want to tell yourself that's not reflective of me, the more times you hear it and the more times you see it, it gets harder to shake and not that become part of you. So our school division, we move towards adding growth as an element in our school division, but unfortunately the state still requires us to test also on the grade level achievement. Our Board of Education, our state superintendent, is really trying to help shift that focus, but our General Assembly, they need us as the delegation to come along to change the laws to allow them to do that.
Now, what about charter schools? Virginia does not have very many charter schools compared to other states.
We don't. Our charter schools are part of our school boards, and so our school boards do have the ability to do that. We've seen some in the city of Richmond that have been successfully run by their school board. So that's part of the conversation too in public education. I also have a bill right now for recovery high school. One of the things our school divisions are not set up to be able to tackle is the growing amount of mental health as well as substance abuse disorders that we're seeing. And legally, we're not able to treat substance abuse disorders the same as we would other diagnoses that you're able to get a 504 plan or that falls under IDEA. And so I have a bill. Is that
the individual development education?
It is.
Okay.
And so I have a bill this year that would set up the first regional high school specifically for students who have a substance abuse disorder or struggling with substance abuse. And the goal of that school would be 2 things. 1, long-term recovery, and 2, academic success. Today, if you are a parent of a child struggling with substance abuse, you can have homebound services for your child. That's 6 hours of education a week. It's grossly inadequate. You can pay a whole lot of money if you're financially able and pull your child out and send them to treatment facility or to private school facility. But we have a lot of folks that are unable to do that. And so there are some great success models. There's an association, a National Association of Recovery High Schools. They have best practices. And so I have a bill this year. It would impact 15 school divisions. We would work together to serve our students. It would go from Goochland, and then you follow all the way down through the Richmond region and the Tri-Cities region and finishes up at Surrey and Sussex. So those school divisions, we work really well together for Appomattox Regional Governor's School for all of our children for the arts. And we are looking forward to working together to support our students who have different needs.
So what percentage do you think of our students have these drug-related problems?
Right now, that number is continuously growing, so it's hard to put a pinpoint on it. It is growing. I know between 2 years, they saw a 16% increase in reported And in looking at our teen suicide rates or thoughts of suicide, in Chesterfield County, we implemented in 8th grade a program called Signs of Suicide. Every single child in the whole grade level is educated on how to look out for signs of suicide in others, how to notice things within yourself that might be signs of suicide. And then what we have seen as a local school division, just from implementing that over the last few years, how many students voluntarily share through that they've seen someone else that has started from a substance abuse, but it really, the bottom line started with a mental health issue, using that substance to manage symptoms. And so we've been able, through tools that we have, to uncover a lot of the things that are plaguing our children and trying to get those out from being stigmas. Part of our program of Signs of Suicide was so that we're all talking about it. Every single person is talking about it, and it's a safe place to talk about it. What we know about students who are struggling with substance abuse addiction is that it's a disease, and the safest and most highly successful long-term recovery is when you're in a place where you're not going to be tempted and have it around you constantly. And unfortunately, we know our high schools are one of the places where most folks are easily able to obtain substance abuse items. So that's one of the things I really hope that bill will tackle. It made it out of a subcommittee yesterday, and it was referred and reported to the Appropriations Committee. So I'm excited to see its continued success.
You also have some legislation dealing with DMAS. What does that mean?
I do. So right now we have a lot of individuals who are living in the state of Virginia who have various disabilities. And today there are different waivers that you can obtain and to receive services. Some of it is for personal assistance that you need. For example, someone who is capable of working, but they have to have assistance in order to get out of bed. We have all sorts of different waivers that allow folks with developmental disabilities, and we call those family and community and home supports. We have a waiting list for a lot of those waivers. We have another program that's called Medicaid Works. Medicaid Works allows you to earn more income than our other waiver programs. Those are income limited. However, a whole lot of people will not take the higher income job and move over to Medicaid Works because there's some risk associated with doing that. You lose your current waiver and your current supports to take the risk that you'll be successful here. So what my bill would provide, it's 180 days that we give you the same services you've been receiving, and you get to basically temporarily hold your spot in that existing waiver to go and move over to Medicaid Works, to try the higher income, the more challenging job that you're capable of doing without all those risks associated that if this doesn't work, you still have your slot. So it's not long-term, there's a limited amount of time there. We have a lot of individuals who are extremely capable of filling much needed jobs in our communities, but they cannot take that risk knowing they won't have the assistance to get out of bed in the morning or to get dressed. And so my bill helps move that. It also should, if enough people successfully move over to Medicaid Works, address our wait list at the same time. So that bill has not been heard before committee yet, but I'm excited when I get to present it.
Now, what about military? Do you have a lot of constituents who are either retired military or are currently serving?
I do. Our district is the proud home to Fort Lee as well. So a portion of Fort Lee is inside the 62nd, and therefore, if you've ever lived close to a military installation, everybody lives in the community around it as well. I heard time and again from spouses of both active duty and retired that a lot of spouses have professional and occupational licenses from other states as they moved around. And in Virginia, we've honored reciprocity for the actual veteran, but not for their spouses. So my bill, House Bill 930, I combined it with Delegate Willett's House Bill 967. So that's the form it's now in 967. That bill will allow both spouses of active duty as well as within 1 year of your retirement from active duty. Those spouses can come to Virginia. They will get reciprocity for any licenses they have. We know there are a lot of jobs that we want filled, and what better way than folks who've been supporting our country by supporting their spouse in the military.
Now, we talked a little bit about the students who are afflicted with drugs. Our students bring many more social problems to our schools than 50 years ago. There's a lot more poverty. There's a lot more domestic violence. Teachers and counselors have a lot more responsibility these days. How are your schools faring in terms of funding for counselors and other people who are necessary in our school system now?
So I served on the Chesterfield School Safety Task Force, and I actually chaired the subcommittee on support services, which included counseling. We made a recommendation to the state to improve the ratio for counselors to students so that we have more professionals to young people. But we also coupled that and encouraged the state to do a study of what is the current workload and what does it look like for our counselors. Sometimes just adding more of those professionals isn't the only answer, and I would submit to you that's our case here. We have counselors who are doing a lot of other types of tasks that we could probably find a much larger workforce to take on. So I think step one, before we hire a whole lot of additional counselors, is to really evaluate what's the scope of what they should be doing. What are their credentials? What is our need for having their professional job in our buildings, and make it that that's their time and that's what they're going to focus on. Take the things off their plate that administrative supports and other types of administrative office help could take care of, because we can find a lot more of those skilled folks in our communities we know than as many licensed counselors and therapists. So hopefully folks look at that as well. Unfortunately, our SOQs for the state, our standards of quality, don't support hiring more support staff often. It's usually the actual teaching positions. And I think that's another reason why our SOQs need to be reevaluated. We should be able to include, if it means a counselor can spend more time working with children, then we should receive funding for the things we can take off their plate that still must be done in order to help kids.
Now, how are we using our school resource officers? There's been some complaints over the past few years that they've been acting more like police officers, and more kids have been sent to juvenile court than necessarily should be.
I'm a big proponent in our schools being able to handle the things that our schools can handle. There are things that we would not tolerate inside or outside of a school building. So I think two things. Number one, our school resource officers are police officers, and they are required to follow the law, whether they're in our school building or not. And I also think our children need to know that you can't behave one way in one place and behave another way in another and not expect a consequence. I think we're setting up some of our children for failure to thrive in our communities if we're not helping them understand that. But I think the consequences that they receive, that's what we need to look at. I think our children, we need to help. I discipline my own children, but I discipline in a way that you've learned something and you make a better choice the next time. I don't think some of our tools that we're using right now are helping our kids see, how do I make a better choice the next time? So I think we have a lot more room when you look at our low level of counselors that we have. You have teachers who have a lot of kids in their class and they don't have the ability for as much one-on-one conversation with children. And so I think the focus looking at how do we get more resources in our schools who can help our kids make the right decision the next go around, that we're not punishing them so harshly on the first time, that they are able to see that there's a better choice. But our school resource officers, folks forget that they're police officers first, and we have them mainly in Chesterfield. We have them in our secondary schools, middle school and high school, and in elementary school, we have more community officers who come in. So they come in to lay the foundation of, I'm here to help in your community, and they start to lay the foundations of what our rules are in the community and how we help one another. How do we keep each other safe? When you see something, you say something. And that's been extremely important. I think what you'd see in our elementary schools is a lot more officers having lunch with kids, and our police department brought back the Police Athletic League over the last couple of years. So lots of kickball, dodgeball, flag football. I think just a lot of room for growth in terms of community policing efforts. But we're actually down in funding for public safety. At a time where we're talking about safety in our community. I am disappointed right now in the lack of funding for our public safety. We had all these officers here at the Capitol, and while it was appreciated and they did a great job of keeping all of us safe, I think if you look at the rest of our Commonwealth who didn't have resources because we had so many of our state police here at the time. So again, just looking at priorities, and I know in my community, I heard loud and clear public education was extremely important. The community in the 62nd wants better quality jobs attracted to that area. And then looking at accessibility and affordability of healthcare. Those were the things over and over again at doorsteps I had lots of conversations about.
So what about attracting and retaining good teachers?
Yes. So when you look at our teachers today, I had a lot of sad conversations at doorsteps of folks who are in the teaching profession or who had retired. One is the lack of support for the increased behavioral problems and trauma that we see kids experiencing in our schools. There's nowhere for kids to go, and teachers have 20 plus children that they're trying to educate and move forward, and one bad day for one child is having such an impact in classrooms. And we can't expect our teachers to do everything. And so looking at how do we reshape the resources available to our schools. We have a lot of families that are in need of support services, whether that's done inside the school building during the day or outside. We have a lot of our schools now have therapeutic day treatment, but the strict federal and state regulations around who can qualify and who cannot means the vast majority of our children are not able to receive those services. So I would really like to see, and I think our teachers would feel more supported if we had less restrictive programs in our schools for students who need assistance in behavior modification and in receiving therapy. So that's one of the things I heard. In terms of attracting teachers, I think we need to also look at pay. It's something I actually co-patron a bill to increase to the national average or above the national average, our teacher pay by 2025. It was aspirational in the current law, and I supported a bill to no longer make it aspirational, but that we get there. But also honoring our teachers as professionals. It's one thing about pay, but we also do a lot of mandating of things that we, as non-experts, think that they should do when they're in the classroom each and every day. So really listening to our teachers. I sat, not in a committee I'm on, but in an education subcommittee and listened to bill after bill coming up with non-educators, me included as a non-educator, bringing up well-intentioned bills, but ensuring we're pausing and asking those in the profession, what is the intended and unintended consequence of this on you as the professional? And we don't ask that of them often enough. So.
As you indicated, access to affordable health care is a problem in your district, the Commonwealth, and nationwide. What do you think we can do here in the Commonwealth to increase access to affordable health care?
I think some places it is accessible. If you're in a higher income area, it's accessible. Folks tend to want to locate their primary care doctor's offices close to you because you can afford to pay. Something that I would love to see in our areas that are underserved, which would include our rural and our more urban areas, are programs to attract doctors to open up independent offices there, giving loan repayment for medical school if you're willing to locate there for X number of years and serving. We have a lack of preventive care in most of our rural and urban areas. And when you look at prevention, it is cost savings. We should be investing in it because long term we save money, both individuals and the state. Things that we can prevent, the top diseases that are our top killers of all things are obesity, diabetes, heart disease, all preventable. But unfortunately, a lot of our underserved communities do not have relationships with nurses and doctors because they're not located there because they can't be successful with what it costs to be in operation. So unfortunately, a lot of our underserved communities, Hopewell being one of them, a lot of citizens have to rely on hospital care. And we all know hospital care costs a lot more.
The emergency room.
Yes. And so I am very passionate about prevention. I think we should be doing everything we can to incentivize nurses and doctors to locate in rural and urban areas and focus on ways that we prevent our top killers and things that are the most costly that we know we can prevent. I think some of that also starts in school. They call it in loco parentis. We step in as the parent, as the school divisions while we have your children for the day. And I think part of that care is focusing on the whole child. Are we ensuring they're getting enough exercise, that they're eating healthy, that we're helping them figure out a lifestyle, right? Diet and exercise isn't something that's a fad, prevention is if you carry it out as a lifestyle, you're most successful. So that's what I've hoped to advocate for at the state level, more preventive services in underserved populations.
Let's turn our attention to a subcommittee meeting you just came from.
Sure.
As a matter of fact, public safety.
Yes.
And there was discussion of a lot of gun legislation there. And we had a big demonstration here in the city of Richmond yesterday. What kinds of legislation were discussed this morning?
So this morning was the firearms subcommittee. And so that committee, we heard legislation, one on sovereign immunity. We had a very impassioned husband. His wife was shot and killed in Virginia Beach. And he gave a very passionate testimony about why he believes that if localities want to have gun-free zones, that they do not have sovereign immunity, that they should be expected to protect you.
So in other words, they could be sued if something
They
occurred.
could be sued. Today, sovereign immunity for our localities, it's there for a reason. You know, if you like low interest rates when you need bonds and our fiscal responsibility, it's just like any other insurance company. You have to know your risks so you know how to protect yourself from them. An unlimited ability to sue our government would make it where we couldn't attract businesses and do business and be fiscally responsible. But I also know, having come from local government, we all have risk management offices, and they are constantly looking at where are our risks of liability for things and how do we mitigate that. And so I do think, the bills in their current form today I didn't support because there's more work to do. But I do think if we are going to have gun-free zones, then our government should take on the responsibility of ensuring that they're protecting us in those areas if we cannot protect ourselves. So that was one of the issues. It didn't make it out of subcommittee. It still has work on it to be discussed. There was another bill that would allow employees, government employees, if you had a concealed carry permit, that you would be allowed to, even others may not. That did not make it out of subcommittee. And there was some other legislation in regards to concealed carry permit, if you can open carry, do you need a concealed carry permit? So various bills, none of them made it out of subcommittee. They all will stay there and not be brought forward to the full Public Safety Committee.
But definitely more to come. There's no question.
There will definitely be more to
question
come. We'll have a full docket this year, I'm sure, in the Public Safety Committee.
We got about a minute left, and there's one question I've been asking everybody at the end of the interviews, and it's basically, what will you consider success at the end of the session for you and your constituents?
Well, I would consider success that I've learned a lot on behalf of our citizens. I always tell people when I knock their doors, I don't know everything, and I'm here to listen. And so I've been spending time with citizens from the district who've come to visit me and putting notes in every bill that I'm going to take a vote on what they've said and their knowledge base. But I'll consider it success if I've been able to advocate for the things that my constituents told me were important, which was public education and healthcare and better jobs for our community.
Great. Thank you for being here.
Thank you for having me. Thank you.
Thank you for watching Cable Reports, brought to you by the VCTA Broadband Association and Comcast. Until next time, I'm Woody Evans.